September is Prostate Cancer Awareness Month. It's one of the most common forms of cancer in men. Dr. Nathaniel Barnes with the Memorial Hermann Medical Group Urology Associates is here with us now to help us out. Thanks for being here.
Thank you for having me.
Is there a certain man who's at higher risk of prostate cancer than others?
Yes. So all African American men or black men of American descent or Caribbean descent are at high risk. Any man who has a first degree primary relative, a father or brother with prostate cancer, and now we're understanding that men who have mothers or sisters with a history of BRCA positive ovarian, breast, or uterine cancer are also at risk.
So what can we look for? What are the symptoms that you want people to know about?
Well, unfortunately, prostate cancer has no symptoms until the last year of life, and it's a very slow-growing disease. So it's important to screen men who are at risk, and that would be based on age, be based on race, and be based on family history. When men have symptoms, they're generally in their last year of life, and those primary symptoms will be bone pain. They'll come in with excruciating back pain to the ER, they'll have an x-ray, and we'll see they have metastatic disease. So with it having no significant symptoms, screening is even more important in this case.
And we know that a lot of men are saying, hey, no way, that's just too scary. They're fearful of the screening, but it's a fairly easy process and all kinds of options for them to screen as well, right?
Yes, generally it's a blood test, a simple blood test, a PSA test. Prostatic specific antigen is a protein that's specifically made by the prostate and is used as a screening tool. We might add a digital rectal exam on that, but I know that's what's caused a lot of anxiety in men in the past. But simply a yearly blood test can help us have an idea as to who's at greater risk for having prostate cancer.
And when should that screening begin?
In men who are at high risk, we start at age 40 to 45. In men who are not at high risk, we start at age 50 and generally do it once a year until age 70.
So for most people then, is prostate cancer caught in screening? Since you said any other symptoms that would lead them to come see you would be end of life?
The vast majority of men, it's been caught in screening. Unfortunately, in 2012, we had a sea shift in this country where the U.S. Preventative Health Task Force recommended against prostate cancer screening. So what we've seen from 2012 to 2019 is a 76% increase in men who show up with advanced prostate cancer as their initial presentation.
What about treatment? What does that look like for someone who is diagnosed? I imagine, like you said, early detection is key, so the treatment's going to vary depending on the stage you're in.
Yes. So every man doesn't need treatment. We divide men into risk categories. Low risk, we do active surveillance. So in general, we follow those men every 6 months with a PSA test and every 18 to 24 months with a repeat biopsy. Men who are in the intermediate risk category or high risk category, we lean towards treatment. The two most common forms would be surgery, radical prostatectomy, and radiation therapy. In addition, there are some focal therapies that are starting to burgeon now that would be less invasive or minimally invasive in men.
So you have a lot of options, which is good for people to know. What about prevention? Are there any lifestyle changes or anything, a way a person lives that can make a difference to hopefully prevent this disease in the first place?
That's an excellent question. There's been a longitudinal study at Duke University where I trained ever since about 1980 looking at diet and prostate cancer. And we think in general a high-fat diet may put you at risk, but unfortunately there's nothing we can actually put our finger on and definitively say, stop these things and your risk drops.
What's your overall message then for women, men watching to get their loved ones screened?
Particularly for the women, because women are generally the drivers behind men's health care.
Right.
If your husband is 50 or older, or if you have a positive family history, bring your husband to the doctor, get their PSA done so that we can identify them early. When we identify them early, we can generally almost always guarantee them a normal lifespan. It's those men who we identify late with advanced prostate cancer whose lives are impacted negatively.
Dr. Barnes, thank you for coming in, for sharing this. Hopefully a lot of guys are sitting at home right now on their holiday, and they'll make that appointment tomorrow. Appreciate your time from Memorial Hermann Medical Group.
Thank you all for having me.
Have a good one.